All right. Good morning, everyone. I'm talking to you live from Santa Rosa, California. For those of you who I have not met, my name is Anthony Lim. I am a family physician and have the privilege of serving as the medical director of the McDougall program. And as many of you know, Dr. McDougall has been doing weekly or monthly webinars. And today, for the first time, we are trying a new format where I will be interviewing Dr. McDougall on a select topic. And the topic that we chose for this month is coffee, tea, and caffeine, cutting through the confusion. Dr. McDougall, good morning. How are you?
I am just fine, and I tell you, I am here representing coffee. Somebody's got to defend the world from the last legal high.
See, I was debating whether or not, but I thought just to make sure I have no bias, there's just hot water in it.
Would you do? Rip the Starbucks label off?
Just coffee. Just hot water. Just hot water. I promise. Let's jump right in. Let's jump right in.
All right. Listen, I didn't read any of your questions.
Okay, that's good. We like it.
I have been busy here with all kinds of things. So I'm unprepared with your questions. I'll try and remember what I can about coffee.
All right, we'll work through it together.
The reason Starbucks is $1 billion a year business is that so many of us are hooked. It's you don't just stop coffee. You got to go through withdrawal.
Right.
That's why we serve coffee at the McDougall program, Dr. Lim. We serve coffee at the McDougall program. We don't serve it. We make it available, and we also, when you come in for $5, we'll tell you where the nearest Starbucks is. What used to happen is we would take all the coffee away when people came in. Now, it was always away when I was at St. Helena, because St. Helena is an Adventist organization, and part of their religious teachings are no caffeine, no alcohol, no heavy spices, and they do it all themselves, but they tell everybody else not to. But when I left St. Helena Hospital back in 2002, I went to our place now where Anthony does a superb job taking care of 50, 60 people at the McDougall 10-day program. And there, we initially tried to hide the coffee. And then people found it in their rooms. And then they found the restaurant, and pretty soon they found Starbucks, and it was all over. And that was the day that people stopped going to their rooms after the first day with headaches and fatigue and not able to participate in the program because they were withdrawing from coffee. So after that day, we told them, look, this is not a drug rehab program. This is not a drug rehab program. This is about getting health back, and what we're here to do is to teach you about the food that is poisoning you. And that's absolutely. And some people can give it up, and some can't. And I'm not going to tell you what's in here, but you just watch the outside of coffee.
Well, that's a good start. Let me use as a starting point a couple questions that really all allude to the same thing. As we know, caffeine is the #1 consumed psychoactive substance in the world. And so there's a lot of curiosity about its health properties. And so I'll just read to you a few of the questions that all get at the same thing. This one's from Anna. Hi, I still drink my morning espresso and sometimes teas. What's wrong with that? Another one from Julia. Is my 1 cup of coffee per day really hurting anything? What if I drink it black? And then the last one. What are the cumulative effects of caffeine over time for someone who's hooked on strong coffee every day? And that's from Sid. So basically, we have 3 questions, and those were just a few that I chose that all essentially get at the same question. People who have a coffee or tea or some sort of caffeine habit and are worried or concerned that that may be a deleterious or health compromising habit. And is it or is it not, or is it in between? What is your response?
Well, coffee is, of course, popular. There are only three things in life that have no adverse effects, as far as I know. And that's clean air, clean water, and clean food. Everything else you do, take whatever has both positive and negative effects. The positive effects are obvious. People get high. And some like it. They drink decaf. The negative effects. There are negative effects. They're indigestion for sure. Every serious coffee drinker carries around a pack of Tums or some kind of antacid because they have indigestion. And I want you to know, this is really important to understand, is that decaf coffee gives as much indigestion as regular coffee. It's not the caffeine. So if you're looking for the high, you get some other source of caffeine, you get just as high without the indigestion. And if you're one of those people with indigestion, you can, I can't understand why I have this. I drink decaf coffee. What is this business about my stomach hurting? Well, it's not. It's the other alkaloids in the coffee that cause indigestion, not the caffeine. And it's the same thing with your cholesterol. Some people worry about their cholesterol going up with coffee. It does, and with decaf. But it's not the caffeine. There are other alkaloids in the coffee that makes the cholesterol go up. So you might want to stop it for those two reasons. You have indigestion, acid indigestion, or you have high cholesterol. And high cholesterol it goes up with coffee. Let me just go on one tangent here, Dr. Lem. There's a lot of confusion when I was probably your age, maybe a little younger, about coffee and its effect on lipids, blood lipids, cholesterol, triglycerides, and so on. And they did a lot of studies published in good journals like Lancet, British Medical Journal, good journals. Good doctors, too, really good doctors. And some studies showed that cholesterol went up about 10% with coffee. Others showed no rise in cholesterol. They tested decaf coffee, and it went up a little higher than 10%, up on the 11%. Well, the investigators started looking at what they were doing, and they found out that in those that the cholesterol went up, they were brewed by a method that did not filter the coffee. If you put the coffee through a paper filter, the paper filter will take this alkaloid out of the coffee mixture. Still tastes, as far as I know, is good. And you don't get the cholesterol to go up. But if you take and brew coffee in say, a little like a little can, they used to brew them with holes in them, with the coffee, and then it goes through these little holes, no paper filter. That's the old type of coffee. It will raise your cholesterol. Let's see, other cholesterol problems. They used to say that cholesterol raises your risk of dying of heart disease. There's a lot of debate on that, whether it does or not, whether coffee causes cancer or not. I don't know. It could, I suppose, it's irritating. What do you know, Dr. Lim, about what other adverse effects do you know about coffee? Certainly, you can.
Well, I mean, certainly, certainly a stimulant, and so for people who suffer from insomnia, it's one of the last things that they should be drinking. Especially, it's interesting, Dr. McDougall. A lot of people are unaware of the long half-life of caffeine, which is around 6 hours, and by half-life we mean the time it takes for 50% of the caffeine to be eliminated from your body. So that means that, a lot of colleagues of mine, they drink a coffee after lunch around 2 p.m. That means that around 8 p.m., just as they're trying to unwind and get ready for bed, they've still got 50% of the caffeine coursing through their blood. And if you, estimate that 1 6-ounce cup of coffee has about between 100 to 150 milligrams of caffeine, you've still got 50 to 75 milligrams of caffeine going through your blood. So for people with insomnia, I think it's a no-brainer. They should absolutely stop. And just to summarize some of the good points you made, absolutely, people with reflux, they should be not just avoiding caffeinated coffee, but also decaf. Interestingly enough, I did read a study that showed that switching to tea oftentimes will improve their reflux symptoms. So for some people who still want some caffeine, they may be able to drink tea and find that their reflux is well controlled. The other good point you made is about the increase in cholesterol. And, I read your newsletter. For those of you who want to learn more, Dr. McDougall has a July 2004 newsletter entitled Coffee, Pleasure and Pain. and then an October 2004 newsletter entitled Tea Time Increases Lifetime. So that's for further information. But in your newsletter, you talk about the diterpenes in coffee, both in the caffeinated and decaf, and specifically two called caffeistol and cawiol. And that these are the culprits responsible for increasing both total cholesterol and LDL. And that you can remove them simply by using a paper filter. I think the questions you raised at the end are really interesting ones. What is coffee or caffeine's relationship with cardiovascular disease and cancer? And I did a little bit of research, and I was curious to see what you thought. This one's entitled "Coffee Consumption and Risk of Cancers: A Meta-Analysis of Cohort Studies," and this one was from 2011. And basically, their conclusion was that findings from this meta-analysis suggest that coffee consumption may reduce the total cancer incidence, and it also has an inverse association with some types of cancers, including colorectal cancer, breast cancer, hepatocellular carcinoma. So I thought that was really interesting, and that was new to me, that it's actually, they found an inverse association with both total cancer and specific types of cancer. Any thoughts on that?
Yeah, I think that's pretty consistent with what I read for the last 40 years. There's one other side effect I do want to bring up, because it's one that every serious coffee drinker knows about. Every serious coffee drinker knows where every bathroom is in every store, because coffee irritates the bladder, and boy, does it make you go. And not just the bladder, but also the bowels. So if you're having frequency and you're drinking coffee, stopping the coffee is a major step in solving that run to the bathroom every 5-minute problem. So, yeah.
Yeah. So I that's a good point, and I guess it goes both ways, right? So certainly for women and men suffering from urinary incontinence or urinary frequency, they should avoid coffee or high levels of caffeine. But on the flip side, some of our patients who have some constipation or difficulty with regular bowel movements, a little bit of coffee can actually help them go more regularly.
Yeah, coffee's been around for a long time. It's going to be around for a long time. They don't even, there was a day when coffee was talked about, it was 30, 40 years ago, as a real health hazard. They don't talk about it that much anymore. But you can't really rely on what people talk about in terms of food these days. There is so much money involved in teaching you to kill yourself with a fork and spoon that old discussions about how coffee may play some adverse effects that we don't bring up anymore. They've all been paid for by the dairy industry and meat industry. There's no space to buy.
Right.
So whatever you learn that is true, you're not going to learn it on regular media. It's all bought up. Hopefully, when you listen to Dr. Lim and myself, and other people with similar education, similar experiences, you'll hear some messages that you will, that makes sense. Not only is it coming from a responsible, clean person, it just makes sense. And after you find somebody like Dr. Lim or myself or Dr. Esselstyn or Colin Campbell say these things thousands of times and have the audience check them, fact check them, and so on. And then they apply the principles of eating lots of starches, rice, corn, potatoes, and cutting out their meat and dairy. And they become believers. And nobody changes.
Absolutely.
And then you're done. You finish your, But if you're looking for a negative message on coffee out there, you're not going to find it. And I think that it's not health food. I think if you're looking for the best health you can get, you should not drink it. If you're looking for a high,
Yeah, and
you just, yeah, it's we have to pay for it. There's a price to pay.
I want to circle back to your comment on cholesterol, because that is concerning if it increases total and LDL cholesterol. And I mean, ultimately, you and I have talked a lot about numbers, right? It's not so much the numbers we care about, but if it actually increases the odds of clinically important outcomes, such as heart attack, stroke, or worst off, death. I did a search on, the relationship of coffee with total mortality. And this one is from the New England Journal of Medicine, Association of Coffee Drinking with Total and Cause-Specific Mortality. New England Journal of Medicine, for our listeners, is probably one of the most well-respected journals out there. And this was from 2012. And they looked at over 200,000 men and 170,000 women as part of the NIH AARP diet and health study. And what their end conclusion is, in this large prospective study, coffee consumption was inversely associated with total and cause-specific mortality. In terms of this cause-specific mortality, they talked about deaths due to heart disease, respiratory disease, stroke, injuries and accidents, diabetes, and infections. So is some, definitely an interesting article that, bottom line, they found that, coffee consumption actually was associated with a decreased risk of total death as well as death from specific causes such as cardiovascular disease.
Will you please send me that study? People love to hear good news about their bad habits. I want that one plastered all over my office. And, that's what people do, is they look at information like that and they say, well, remember, they say, oh, it's good for me. But remember, right. It is like other things in life. If it has effects, some of them are good, some of them are generally not good.
Absolutely.
Pretty much, and you have to weigh things. And Dr. Lim, I'm not going to ask him whether he drinks coffee or not, but I do share an office with him occasionally. But you got to make your choices in life. You got to know the truth. And we're trying to focus on the people at the McDougall program, all of our staff. We're trying to teach you the truth so you can make some decisions. If you want a pepperoni pizza, have fun. But if somebody lies to you and says, look, pepperoni pizza builds stronger heart muscles, and you go eat it with that attitude, even though you hate it, it's too salty and so on, you've been lied to, that's not fair. So there are all kinds of liars out there. Liars, liars, liars. No, I used to think it was bad to call a person a liar. Lying has become the national pastime. And when it comes to business, they have more reason to lie than anybody else. So if somebody tells you the truth, tells you that this coffee, it makes you feel good. In about 10 minutes, you're really up there. You guys wonder why I have so much fun in these webinars, right?
Well, and I think
you also realize that it's making you pee every 10 minutes, and realize it's giving you the indigestion and so on. It's not health food. It is not health food. Tea is more health food than coffee, I'd say. The adverse effects are fewer, and the positive effects are fewer too. That's why there's not a bunch of star tea shops around town. Who wants to buy star tea? Let's Starbucks coffee.
Right. Well, and I think the most important takeaway I think you and I completely agree on for our listeners is that no amount of antioxidants that you might get from coffee or tea can compare to the power of a starch-based diet based on fruits, vegetables, legumes, and whole grains. So it's not some sort of miracle antioxidant food that is going to protect you from all the ills of the standard American diet. So wouldn't you agree with that?
I do. In fact, I think what we ought to do is start doing some bargaining, make deals with our patients. Say, look, you drink coffee, you also have to like bacon and eggs.
Right.
You're overweight, your cholesterol's high, you just had 4 stents put in. What do you choose? Bacon and eggs. Well, I like them both. Well, this one's going to give you a heart attack. This one probably won't. You can't have everything in life, nor do you have to be deprived of everything in life. But I think you need to be properly informed. That's the thing that has troubled me most for the last 40 years is that people don't want to. They can't make choices. And so you're a mother and you lose your child. And you're a son and you lose your father. Totally unnecessary. I can't tell you the number of friends I've had who've lost their parents when they were young. And the parents were in their 30s and 40s. And everybody was eating the rich Western diet. And nobody knew the truth. And, these kids wanted their parents very badly, and the parents wanted to keep the family very badly, but they died because somebody told them, that it was good, especially for protein and calcium and so on, eat these foods. And you had your dad die at 32.
Dr. McDougall, we had a question from a listener who's concerned about coffee or caffeine and arrhythmias. And for our listeners who don't know, arrhythmia means irregular heart rate or heartbeat. One of the most concerning being one like atrial fibrillation. And I know from your newsletter that there's definitely a concern around palpitations from coffee and a possible triggering of irregular heart rate. But I wanted to ask you what your thoughts are on the likelihood or concern of coffee causing irregular heart rate. And I'll just show you one. I did look it up too. This one was about caffeine and atrial fibrillation. And the title was Caffeine Does Not Increase the Risk of Atrial Fibrillation. This was based on a systematic review in the journal Heart from 2013. And their conclusion was that there are isolated case reports of people who ingest in huge amounts of caffeine and trigger some sort of arrhythmia. But that when you look at habitual coffee or tea drinkers on a long-term basis, that there is not actually good evidence that it increases the likelihood of atrial fibrillation or some sort of ventricular or atrial irregular heart rate. So any sort of thoughts or comments on that?
Yeah, I'm glad you looked it up. I don't know the answer. But I would have assumed that caffeine stimulates irregular heartbeats and would take somebody who is on the edge of an permanent irregular heartbeat and slip them over to the irregular side because, it stimulates. But it's nice to know in a population study that they didn't find any real increased risk of atrial fib. And by the way, atrial fib is caused by the same thing that causes heart attacks and strokes. It's atherosclerosis. In this case, it's most directed at the small arteries of the heart. The little tiny microvascular vessels get clogged up, same way the big vessels do. But when you do an angiogram, you can't see it. A person with atrial fib may have perfectly clear arteries at that level of vision. But when you get down to the autopsy table and you get the microscope out and you look at the little tiny blood vessels, you find that atherosclerosis is very prevalent in people who have atrial fibrillation. This, by the way, it all came out of the Framingham study.
Right.
Yeah. But just, people wonder why you do it.
Yeah. Okay, well, we had a few listener questions that I wanted to run by you before we bring things to a close. One of them is about decaf, and let me find that. Is water processed decaffeinated coffee okay? Or basically, what concerns do you have about decaffeinated coffee, if any?
Well, as I mentioned, decaf raises cholesterol. and causes indigestion just as frequently as regular coffee does. It's not the caffeine that causes the indigestion or troubles the lipids. It's other chemicals, organic chemicals that are in the coffee bean that cause these things. I've got pretty much covered why you not have coffee in your life. About 40% of people in the world do drink coffee or related beverages. You know, it's a fun thing. It's as I say, it's one of the last legal drugs available.
Okay. And speaking of drugs, there's a few listeners that really want to quit. They feel that it's having a detrimental effect on their life, and they're having difficulty quitting. One of them came from Michael or Michelle, and he said, "Why is it so difficult to quit caffeine? I have tried, but I basically could never do it." Any thoughts on how you would advise our listeners to quit their coffee or tea or caffeine habit, given that, as you said, it is a drug and it can lead to physical dependence?
Yeah, I talked quite a bit about this when we first started, because we see 50, 60 people, sometimes 40, who come to the McDougall program for your help and my help. And when they quit, most of them have withdrawal. What do? Well, you deal with it like you would heroin or tobacco or alcohol. And you can't cut down on these things. Quit. The only way I've found for people to quit real addictions, and sometimes habits, is for them to decide, today I am a smoker and tomorrow I am not. And no matter what happens, I am not going to smoke. The same here with the caffeine. Then about 3-4 days later, you stop getting the withdrawal symptoms, which would be, you're tired, you quit the coffee, and you got a headache because you quit the coffee. And well, I want to tell you, I'm not telling you what's in here. But drinking coffee is a real serious addiction. You treat it like just a little mamby-pamby habit, and you're going to be a coffee drinker forever. Because it takes real concentrated effort to stop a powerful addiction to whatever they put in coffee. And to make Starbucks one of the biggest companies in the world.
So your take-home message is that having a little bit is not going to work. It's you either completely stop or not.
If you're really addicted. You know, I can have an occasional cigar, I guess. The last one I had, probably when I was 11. But I could have an occasional. I could not have an occasional cigarette. Mm-hmm. Give me one Marlboro or 2 or 3, and I'll be up to 2 packs a day. Fortunately, I stopped that habit in 1972. Same thing with coffee. If you're really an addicted coffee drinker, you have to make the decision that that's not going to be you anymore, period. Regardless. And then you'll thank yourself that you made that decision when you get over the withdrawal symptoms, which is long. It's only, like I say, about 3 days. And you'll be very thankful. And you'll continue until one day you'll just say, well, I'll just have one more cup. Or maybe my friend here just left half of a cup of coffee and I just had that. That was really good. And then the next day it's another cup, and it's just like all addictions. It has to be 100%. I'm sorry. The way the body was made. Things that we become addicted to. The other things that you do when you're dealing with addiction, don't go hang out at Starbucks the day you quit.
Yeah, and as I like to quote you as saying, with regard to a lot of the facets of the standard American diet, for some people, moderation is not an option, right? So
for everybody I know, it's not an option. I certainly can't deal with moderation personally.
Right.
And believe me, I've meddled in an awful lot of things. Unfortunately, I've been able to get the resolve to stop them. But it's hard. It's really hard.
Any comments? One listener asked about Perot, P-E-R-O, the coffee light product made from chicory, barley, malt that we actually serve at the McDougall program. And they just asked if this is a safe beverage for them to consume.
I have not looked into it. Have you? A chance? Probably. It's not very many people drink it, so it's probably not very, very, very dangerous.
Yeah.
I don't know.
Right. Okay.
And really, coffee is real easy to get from the McDougall program. And in fact, some people even carry it into the classroom while I'm lecturing and you're lecturing. They don't even try and fool us, Dr. Lamb. They don't even try and make a show out of it. Hide it behind their back. They just kind of walk in. Big Starbucks. And all I say to them is, I hope you didn't get it with cream.
Right.
Those coffees can be like 700-800 calories. Well, the other carbs. But if you need the coffee, you can get addicted to black coffee and do a lot less harm than you can with the combination of cow milk.
Yeah, and I think that is really one of the biggest problems is it's what people are putting in their coffee or their tea, right? They're putting cream and sugar and whipped cream and these mocha frappuccino concoctions. As you mentioned, there's 600, 800 calorie bombs that are detrimental to their health. So that is a huge issue, is what people are putting inside their coffee.
So if you decide you're going to make some source of caffeine part of your life, because it feels good. It feels good. Then, pick the safest one you can find.
Right. All right. Well, what I'm going to try and do is to give our listeners some take-home points that they can walk away with from our conversation, and then please add anything that you see fit. But take-home point number one is that without a healthy plant-based diet and lifestyle, no amount of antioxidants from coffee or tea is gonna save you. They are not superfoods that will save the day. Number 1, 2, and 3 most important thing is to center your diet around a starch-based diet filled with fruits, vegetables, legumes, and whole grains. Number 2, moderate coffee, tea, and caffeine consumption is likely safe for most people. And by moderate, we're talking, less than 4 cups of coffee per day, with a cup being 6 ounces. And possible, studies showing even some health promoting benefits, such as decreased incidence of diabetes, dementia, mortality, and heart disease. But as Dr. McDougall and I talked about, there are certain groups that you really want to exercise caution with when it comes to coffee and caffeine and tea. Number 1 are people with reflux, because as Dr. McDougall mentioned, both caffeinated and decaf coffee both worsen reflux, though you may find that tea works for you. Number 2 is people with incontinence, urinary incontinence, or who already are going to the bathroom a lot to urinate. This is only going to make it worse. But on the flip side, for people with constipation, it could be beneficial. Other groups that we didn't talk about that need to exercise caution are patients with epilepsy, because certainly the caffeine has been shown that it can worsen or increase the frequency of seizures. And then pregnant women. Pregnant women are cautioned to avoid taking in more than 250 milligrams of caffeine per day, which is about 2 cups of coffee. And the reason is there's a possible association with increased rates of miscarriage or low birth weight. Point number 3, watch what you put into your coffee, right? The healthiest way to drink your coffee or tea in general is black or without any additives, because then it's essentially a 0-calorie beverage. I was talking with Jeff Novick the other day, and as he said, it's not coffee that people want, it's the cream and sugar that they put in it, because if you take away the cream and sugar, then they have no interest in the coffee. So you really need to watch out for that. And in the spirit of full disclosure, I do drink an occasional cup of coffee, not every day, but maybe about 2-3 cups a week. And how I drink it is black. And same with tea. I drink my coffee and my tea straight. Point number 4, if you are not drinking coffee or tea, do not start. Do not feel like you should start if you are not drinking it already. This is really for people who are, like our listeners who are drinking 1 cup of espresso, 1 cup of coffee per day, and are concerned whether they're compromising their health. And I think the take-home message is, as long as they're not putting a lot of junk in it, it should be okay. But please do not start drinking coffee or tea if you are not already. Point number 5, we didn't talk about energy drinks, but I think you and I both agree there's no benefit to energy drinks. And in fact, they're pumped full of artificial caffeine. It's led to a whole glut of ER visits. So stay away from those. They're filled with chemicals and offer none of the potential health benefits that we discussed with coffee and tea. And then the last point is, as you started off this conversation, caffeine is a drug. In fact, the latest DSM, which is basically the manual of psychiatric disorders, they actually list 4 disorders around caffeine: caffeine intoxication, caffeine withdrawal. So clearly, it's causing a lot of harm for people who are really hooked on it. If you fall into that category and you want to quit, then cutting down is oftentimes not a successful strategy. You are more likely than not going to find success if you just completely abstain. And just remember Dr. McDougall's words: moderation is not an option in that regard. Anything else you want to end with, Dr. McDougall, or close with?
No, I think that was a great summary, and it was nice of you to tell people how much coffee you drink. Generally, the answer is when you go to the doctor, talk to the doctor, and the wife asks how much is too much alcohol for my husband to drink. And doctor says, well, probably too much alcohol is 2 more drinks than I drink. It's really, you watch carefully who you listen to when you give advice. People giving out advice on coffee or other things that they may be in love with, addicted to, and so on, do have a tendency to defend it. And so thank you for letting us know that you do drink it and that you are fully aware of all the pluses and minuses, and you still have decided to include it in your life. That's the way everybody should. They should have the knowledge so they can make choices. That's all. That's our goal on this webinar, is to give you the right information. And we always ask. I'm not saying goodbye with this. We always ask people to call up. You can call the 800 number. You can write the office at drmcdougall.com, whatever. If you have some questions or you disagree, if you think that what we are talking to you about in terms of meat and dairy is just nonsense, and we just don't seem to have people calling up and disagreeing with us. And I assume that's because they don't, but maybe because they don't think we're worth the trouble. Yeah. You can call us and we'll answer your questions, and pretty much everything we do, including this webinar, is free. And we have some great programs coming up. There's June 8th. It's full, isn't it?
Yes, it is completely sold out. The June program.
The June program.
So almost 60 attendees coming.
My goodness. You and I are going to be busy.
Oh yeah. And speaking of which, I wanted to share with you, end on a success story. This is from Leonard, and I think you would enjoy hearing this. He shared on Facebook that he is still at 25-pound weight loss, and that he had his blood test a week ago. Originally, his A1C was 7.0. And that was last year. And then after the program in February, it came down to 6.1. And then he just had it done a few weeks ago, and his A1C was 5.8. So he has essentially reversed his diabetes. And he had this to say: I had my appointment with my endocrinologist that I'd met with just before going to the 8-day immersion program. He had told me this program would not work. I wanted to go back to my 6-month appointment to show him he was wrong. He got my blood results and said I'm doing so well that he doesn't need to see me anymore. I'm just going to my family doctor from now on. I am sticking with this diet. And I wanted to end with that just to re-emphasize that, we're talking about caffeine and coffee today. We want to, the goal of some of these webinars is to choose a very concrete topic that is on the minds of you all. But we don't want it to ever be a distractor from, first and foremost, the most important thing, which Leonard has learned, which is the diet, the healthiest diet on the planet. So, Dr. McDougall, I want to thank you for your time this morning. I think hopefully our listeners feel more empowered and knowledgeable. And I look forward to potentially doing similar future ones with you on other topics that are on the mind of our viewers.
Well, you'll be greatly missed if you don't. People need to hear Dr. Lim. And they need to hear from the younger generation. One thing I've noticed is no matter how hard I try to not let it happen, I seem to be aging. And there will be a day, Dr. Lim, when you are in that seat alone. And especially, you get a dick. I see it in you. I've known you for 3 years. I've sat next to you for hundreds of hours. And I see it in you. I see you go from a physician who wants to help to somebody who just gets totally involved with people at the program and has joy from their joy. It's like the patient you just talked about. I just see the happiness in your face and your heart and so on. To see your patients get well, which is an experience you didn't have back when you were practicing right out of medical school or family practice residency, it's an experience I wish every doctor had. To sit and look at their patient and say, I had something to do with that person looking, feeling, and acting the way they are. Oh, what a great feeling to be a doctor or a nurse or an educator and to be able to know you've helped somebody so much. It's, you're the luckiest doctor in the world, Dr. Lim.
Well, it's like I tell my colleagues or my patients, I feel like a kid in a candy store. So thank you to you and Heather and the whole McDougall program for the opportunity to have a front row seat to witnessing the transformation, health transformation of hundreds of patients. Thank you for being the best mentor I could ask for. And I look forward to more of these in the future. As you said, as you and I joke, right? Seeing patients get better, it never gets old. You have that same joy on your face when you hear stories like Leonard's. So here's to many more similar stories. And in my effort, because I'm trying to be good, we have been on for 43 minutes and 46 seconds. My goal is to keep these to less than 45 minutes. So with that, we wish you all a good rest of your day. May you eat lots of fruits, vegetables, legumes, and grains. And if you are having some caffeine, only a small amount. All right. Take care, everyone.
Dr. Lim brings.